Hello, Terry Lynch here, medical doctor, accredited psychotherapist, best-selling mental health author, creator of mental health courses for mental health professionals and for the general public. In this short video, I'm going to demonstrate to you why it is that the psychiatric diagnoses are not valid, verified medical diagnoses. Within the long-standing traditional medical diagnostic process, there are three pillars. The first one is the history, person's story, what they are experiencing. These are described within medicine as symptoms. These are subjective. They are what the person is experiencing. They are totally valid as such, but they are subjective. The doctor has no way of objectively confirming the presence of these symptoms. The second pillar is the physical examination carried out by the doctor, which, in the presence of a verified medical illness, will reveal signs of disease, such as a swollen thyroid gland in many thyroid conditions, demonstrable weakness of one limb over the other in multiple sclerosis. These are just two examples. Signs identified by the doctor upon physical examination. These are objective findings of disease. The third pillar then, investigations. Laboratory or X-ray tests, for example. Investigations reveal objective findings of the presence of disease. As a general rule within all medical specialties, in the making of a medical diagnosis, all three of these pillars are involved in the diagnostic process. The history, the person's story, the doctor's physical examination, and investigations. The history being subjective, the person's experiences, physical examination and investigations providing objective evidence of the presence of a medical disease. Some general principles around all of this. For most diseases, all three pillars contribute to making a diagnosis. Two pillars contributing, that's not uncommon. Diagnoses based on just one pillar, this is much less common, but it does occasionally happen. In such rare occasions, generally speaking, the one pillar is investigations, because these are the most objective ways of identifying the presence of a medical disease. A medical diagnosis based on just one pillar, this very rarely happens on the basis of the history alone, the person's experiences. Scientifically, this is much weaker. This is not to minimize the validity of the symptoms. They are definitely valid. It's just that they're subjective. There's no way the doctor can confirm the presence scientifically, objectively, of disease based on symptoms. When on rare occasions a diagnosis is made purely on the history is typically striking and specific. For example, an epileptic seizure, classic migraine headaches. Even with an epileptic seizure, there are often objective findings upon physical examination. A person may have wet themselves involuntarily during the seizure. A person may have injured themselves as their limbs were flailing during the seizure. A person may have bit their tongue. All of these would be visible to the doctor upon physical examination. Classic migraine headaches then. These are headaches on one side of the head, sometimes accompanied by what's called an aura, just before the headache. The person having some unusual experience like a very strong smell or flashing lights just before the onset of the headache. Very briefly going through three verified medical illnesses: diabetes, pneumonia, multiple sclerosis. I could do this with any verified medical disease. The symptoms, the first pillar in diabetes, include thirst, hunger, increased urination, limb pain, tingling, numbness, cuts healing very poorly. Signs that the doctor will pick up upon physical examination: a very dry mouth, damage to the circulation in more advanced cases, nerve damage, eye damage, secondary to diabetes. Tests then, the third pillar of medical diagnosis. There will generally be glucose in the person's urine. Blood glucose levels will always be carried out, revealing high levels of blood glucose, confirming the diagnosis of diabetes. In pneumonia, the person is likely to have a cough, bringing up a lot of phlegm. They may have breathing difficulties. They may have a specific type of chest pain, greatly increased pain upon breathing in. Signs that the doctor will pick up upon examining the person: an increased breathing rate, many characteristic lung abnormalities audible by stethoscope. Tests then, the doctor will carry out a chest X-ray, which will, generally speaking, identify the presence of pneumonia. Sputum investigations may also be carried out, seeking to identify the precise organism that is causing the pneumonia. Multiple sclerosis then. The symptoms, the first pillar of medical diagnosis. The person may be experiencing blurred vision, clumsiness, weakness in one of their limbs, loss of balance, Signs the doctor may pick up upon physical examination: limb weakness, decreased nerve sensation, nerve reflexes may be diminished. Tests, the third pillar of medical diagnosis, the doctor will carry out investigations such as a CT scan, an MRI scan, which will, generally speaking, identify abnormalities consistent with the presence of multiple sclerosis. So if we take multiple sclerosis, the diagnosis of multiple sclerosis is given by a combination of the medical history, the person's story, what they are experiencing, the first pillar of medical diagnosis, which is subjective, valid as subjective experiences, the physical examination, what the doctor finds upon examining the person, the second pillar of the medical diagnostic process, which provides objective evidence of the presence of disease, and MRIs or spinal tap results, tests, investigations, the third pillar of medical diagnosis, the second objective pillar of the medical diagnostic process. Let's consider briefly how Parkinson's disease is diagnosed, another well-known, well-established and verified medical disease, brain disease. What doctors look for when diagnosing Parkinson's: certain physical signs and symptoms noticed by the patient or his or her loved ones are usually what prompt a person to see the doctor. Signs and symptoms. Symptoms being the first pillar, as we have seen, what the person is experiencing subjectively. Physical signs being the second pillar of the medical diagnostic process, providing objective evidence of the presence of a medical disease. The Mayo Clinic on Parkinson's disease. Symptoms, the first pillar. Tremor. This rhythmic shaking usually begins in the hands or fingers. You may rub your thumb and forefinger back and forth. This is known as a pill rolling tremor, as if the person is holding a pill between their thumb and forefinger. For example, Michael J. Fox, famous actor, has been very public about his now advanced Parkinson's disease. One can see the contortion within which he has to hold his neck in the second picture on the right. In this brief video, Michael's uncontrollable tremor, movements of his head and neck are an expression of the seriousness of his condition. The Mayo Clinic describes these as symptoms, but more accurately, they're both symptoms, the first pillar of medical diagnosis, and signs. For example, Michael J. Fox's debilitation is very obvious upon observing his involuntary movements. Symptoms and signs, because many of these are very obvious objectively to the doctor upon carrying out a physical examination. Slowed movement, rigid muscles, poor posture and balance, sometimes referred to as a shuffling gait, very characteristic of Parkinson's disease. The person only able to take short, rapid steps, looking like they are going to fall over, fall forward, and they often do. Loss of automatic movements, speech changes, writing changes, their writing becoming very difficult and very different to how it used to be, as a direct result of their condition. We've covered the first two pillars here, symptoms and signs. Thirdly then, investigations. Often in Parkinson's disease, there aren't any investigations that confirm the presence of Parkinson's disease, but they're not necessary because the clinical picture is so obvious. However, upon post-mortem, there are characteristic findings microscopically within the brain called Lewy bodies, which are all of these blue blobs that we see throughout this slide. Any qualified medical doctor who is a pathologist will instantly recognize this slide to be Parkinson's disease without knowing a single thing about the person, their story, their life. So this is positive confirmation on investigation on post-mortem examination. So that's the situation in relation to real verified medical illnesses, including brain illnesses, brain diseases, as we've seen with Parkinson's disease, multiple sclerosis. The three pillars of the medical diagnostic process being long established practice for many decades now. Let's now consider how well the process of diagnosing psychiatric illnesses meets these diagnostic criteria. The Mayo Clinic. How are mental illnesses diagnosed? To determine a diagnosis and check for related complications, the person may have a physical examination, which, as we've seen, is the second pillar of medical diagnosis. Your doctor will try to rule out physical problems that could cause your symptoms. Think about this for a moment. The physical examination is utilized not to make a psychiatric diagnosis, but to actually do the opposite, to rule out physical problems, to rule out biological disease. Next, laboratory tests, which, as we've seen, are the third pillar of the medical diagnostic process. the second and third pillars both being the objective pillars of medical diagnosis. These may include, for example, a check of your thyroid function or a screening for alcohol and drugs. So again, the third pillar, laboratory tests, are used to rule out physical problems, not to confirm the presence of a psychiatric diagnosis as a verified medical disease, but quite the opposite, to actively exclude, to rule out the presence of a verified medical disease, such as thyroid disease, as I've specified here. The third pillar, then, a psychological evaluation. It's upon this and this alone that psychiatric diagnoses are made. But as we've seen, this pillar, the first pillar, is totally subjective. It's what the person's experiencing, meaning that there's no way for the doctor to confirm the presence of a verifiable medical disease, medical illness. By definition, therefore, the psychiatric diagnoses are not verified medical diagnoses, medical diseases, medical illnesses, since such verification requires scientific confirmation of the presence of physical, biological abnormalities via the two objective pillars of medical diagnosis, the physical examination, the second pillar, and investigations, the third pillar, both of which are utilized within psychiatry not to identify objective evidence of a psychiatric diagnosis, a psychiatric illness. They are utilized to the opposite effect, to rule out, to exclude the presence of real, verified, biologically based medical illnesses. So that is the situation. That is the truth. None of the psychiatric diagnoses are medically or scientifically verified medical illnesses, medical diseases. This is important for people to know and understand. I feel it's particularly important for mental health therapists, counsellors, psychotherapists, psychologists, because these groups of mental health professionals can offer a great deal more in working with people with a psychiatric diagnosis than they may assume. Coinciding with an article of mine that's been published in the British Association of Counselling and Psychotherapy's Healthcare, Counselling and Psychotherapy Journal in July 2025, I am creating a course for mental health therapists to increase the understanding of the trauma and psychologically based aspects of these diagnoses that tend to receive little or no attention, little or no focus. If you would like to know about this course and when it's going to become available, which I would expect will be around June 2025, comment below or message me, and I will make sure that you are informed when the course becomes available. Thank you for watching and have a great day.